Hello friends, today I want to summarize our experience in the field of varicocele surgery. We are making microscopic varicocele surgery procedures for more than 20 years, actually it's 22 years. And in the last 15 years, we noticed that there is some missing points in a classical varicocele surgery, and we improved some techniques to make a better quality operation. And we named it ISTANBUL Varicocelectomy technique. What was the missing points that we noticed in classic varicocele surgery? I had my own Doppler device, and I usually do pre-operative and post-operative Doppler scanning to the patient. And we noticed we marked the veins before the operation, and after the operation we search control for the results of the operation. When I was doing this in the conventional way, I noticed that after the procedure there are still remaining veins, and the ligated veins are staying there for a certain amount of time. And this time was 3 months in some patients, 6 months in some patients, and 1 year in some patients. And this was causing too much anxiety in the patients, and overall the removal of the disappearing of the veins was only 70%. So this point was not good for a surgical result, and we were not happy with these results. And another point was the arterial damages. Although we use microscope during the procedure to see the arteries and to preserve them correctly, in some patients there was a decrease in sperm count, or sometimes atrophy in the testicle, decrease in the testis volume. So I noticed that in some patients there is an arterial damage related to the conventional surgery. So these two main points make me think about the solutions and find new techniques for varicocele surgery. The main issue, or let's say the first issue, was easy. It was arterial damaging, and we quickly solved it by using a microvascular Doppler device. These are tiny devices, shows the millimetric veins easily with a special sound. And when we use them, we can differentiate tiny veins, tiny articles and thin articles, and can save them properly. So microvascular Doppler device was the solution for this. But the main issue was the remaining veins. We discussed this with our vascular surgeon friends, and they tell us they remove all the veins in their operations to get rid of them properly. And they said it is very difficult for a vein to disappear spontaneously if you just ligate it and expect it to disappear by itself. So we try to improve our technique, and by time we improve the technique day by day. And now we are understanding that there are three kinds of veins in the scrotum. One of them is gubernacular veins, which is the veins connecting the testis to scrotal skin and located at the base of the testicle. And it is easy to reach these veins if you deliver the testicle. And the other type of veins are external spermatic veins, which can be easily removed in long segments. Again, it needs the delivery of the testicle. And the other type of veins are the internal spermatic veins. These veins are more difficult to remove in long segments, but still we are trying to remove them as long as possible. So during the operation, we deliver the testicle initially, and we ligate or remove the gubernacular veins according to their appearance. If they are very big and ligation will not be enough, we remove them. But removal of the gubernacular veins detach the attachment between the skin and the testicle, and it may cause problems in relocating the testicle into the scrotum. So most of the cases we ligate them in many parts, and try to disappear the vein during the procedure. And for the external veins, we really make very, very long dissections, and sometimes we remove 30 centimeter, 40 centimeter and longer veins. In some patients, there are shorter external veins and we cannot remove long segments, but still we try to remove as much as we can. After that, we place the testis into the scrotum, and then we use the operating microscope to dissect the internal veins. These internal veins, again, we aim to remove them as big as possible, but they are located in very close relation with the arteries. Sometimes they are easily separated from the arteries with dissection. Sometimes they are connected to each other and stuck to each other too much, and it is not possible to dissect them, to separate them from each other. So in that case, we still don't want to remain the vein there, and we want to remove it or disappear it as much as we can. And we make ligations in several parts of the vein, and at the end there is no vascular structure, there is no vein left behind. So that is how we do the technique. This is ISTANBUL Varicocelectomy technique. So it has 4 points, one of them using microscope, one of them using microvascular Doppler device, and the other is removing external veins as long as possible and removing the internal veins as long as possible. Additionally, we are treating the gubernacular veins additional to them. And as we begin to do it more and more, our experience increased and the results come very, very satisfactory. The overall recurrence rate is 3%, and maybe in last 2 years, I did not have to reoperate any of my case because of recurrence, because we find some other solutions like some creams to decrease the size of the veins, sometimes leech therapy to decrease the size of the veins. So our recurrence rate can be roughly said as 3%. And our results also improved too much with the pain. Normally in conventional procedures, testicular pain is guaranteed only in half of the patients to disappear. But in our technique, the pain resolution rate is very, very high. The removal of the vein makes it possible for the pain to disappear just after the procedure. There are some patients who the pain can remain, but we understand that this is also related to the prostatitis, inflammation of the prostate, and we make a therapy to the prostate, and these rare cases also treated during the procedure, and they get rid of the pain. So overall, there are still some patients who cannot get rid of the pain. It's roughly 5 to 10%, but in 90% or 95% of the cases, the pain is resolved during our procedure. So this is the summary of our procedure, and we are improving it every day because we are making too much experience every day with our new operations, and we try to reach the 100% success rate as soon as possible. Thank you for watching.